Hello everyone, welcome to FMT Guru. So we are going to discuss INI-CET November 2022 FMT questions in 15 minutes. There were 9 to 10 questions asked in the exam. So what was the question number 1? The question number 1 was, which one of the following is not a cardiac poison? So the question is about cardiac poison. So cardiac poison, it acts on the heart, it acts on SA node, AV node or the cardiac conducting system, so which causes bradyarrhythmia and death. So aconite is a cardiac poison, cerebra thivacea is a cardiac poison. So it is a true statement, true and true. So atropa belladonna is the answer. So A is the answer for this question. Atropa belladonna is a deliriant. So which is a well-known deliriant. Datura is also deliriant. Okay. So answer for this question is Atropa belladonna or atropine, which is deliriant. Let's discuss briefly about what are cardiac poisons. So this can be asked in upcoming NEET PG exam as well. So one is aconite. You can see here. So this is the aconite. So aconite is a cardiac poison. The root is the most toxic component of aconite plant. So it causes hippus, and it causes bradyarrhythmia, cardiac blocks and death. So aconite is a well-known cardiac poison. Second one. So second one is, this is nothing but cerebra thivacea. Cerebra thivacea is nothing but yellow oleander. So yellow oleander is a cardiac poison. Next is cerebra odolum. Cerebra odolum is also known as suicidal mango. So it is also a well-known cardiac poison. And the fourth one is the digitalis. So digitalis is also known as foxglove. It also a cardiac poison. One more is nicotine. So nicotine. And the last one, nerium odorum. So there are mainly 6 cardiac poisons. What are they? Aconite, cerebra thivacea, cerebra odolum, nicotine, digitalis, nerium odorum. So the toxic principle, toxic dose can be asked in upcoming exam. So go through that. Second question, match the following. So this question was about the seeds, the poisonous seeds in forensic toxicology. So option A, Naxwamica, Rati seeds, Datura, opium, Abrasion, strychnine, hyoscyamine, morphine. So this is the question asked. Match the following. As you know, Naxwamica is nothing but the plant of strychnine. The fatal dose is 1 seed. We discussed many times in our classes. So that is A is equal to, that is 2. A2. Rati seeds, that is B. So the B is equal to, that is 1. So Rati seeds nothing but Abrus precatorius seeds. So A2, B1 and Datura. Datura contain hyoscyamine, hyoscine, atropine. So C is equal to 3 and opium plant D is equal to, that is 4. So answer for this question is, so that is A or the first statement is correct. A2, B1, C3, D4. So just a brief revision. Look at this. So this is the Naxwamica. So this is Naxwamica seeds. So Naxwamica contain strychnine, okay, brucin, loganin. The fatal dose is 1 seed. Look at this. So this is what Abrasion seed. Abrasion, also known as Rati seeds, Abrus precatorius, which is a organic irritant. Next, Datura. Datura is also asked. So this is Datura plant, and Datura seeds contain hyoscine, hyoscyamin and atropine. And remember Datura, so the fruit is known as thorn apple, which is occurs in single, okay, single appearance of the fruits of the Datura. Okay. Next, look at this. So this is the opium plant. So what is the scientific name of opium plant? Papaver somniferum, which contain a natural alkaloid known as morphine. If it contains 10% of the morphine, that is known as standard opium. Yes. So the question number 2, so is clear. Question number 3. Question number 3. So match the following related to eruption of teeth in adults. So very simple question. First molar, third molar, incisor, canine. Options are 11, 12, 6, 7, 17, 25, 7, 8. So first molar, remember in adults, first molar, permanent dentition, first molar appears at 6 to 7 years. 6 to 7 years. So A is equal to 2. Third molar we discussed many times, 1725. So that means it is 3. Incisor, that's about 7 to 8 years. Incisor 7 to 8 years, C4. And D, that is, so that is D is equal to 1. So that is canine, that appears at 11 to 12 years. So answer for this question is A2, B3, C4 and D1. So answer is, so 1 is the correct answer. Okay. Yes. Now age of eruption of permanent dentition, very commonly asked in the exam. First molar, remember first molar, first standard, 6 years. You can say 6 to 7 years. Next, second molar, around 12 years, 12 to 14 years. We discussed many times in our classes. Third molar, 17 to 25 years. Central incisor, 7 years. Lateral incisor, around 8 years. First premolar, 9 years. 9 years. Second premolar, that's around 10 years. Canine, so that's around 11 to 12 years. 11 to 12 years. So this is the age of eruption of teeth in adults. So there are 32 teeth in number, and so the answer for this question is first molar 6 to 7 years, third molar 17-25, incisor 7 to 8, canine 11 to 12 years. So answer is 1. Next, a child came with a presentation of froth at the mouth, which comes out even after wiping. So continuously the froth is coming. Recovered from the scene of crime. So and the child died due to some cause. All the following are seen in autopsy findings in above case except. So it is a case of drowning. So all are seen except ballooning of lungs. Yes, that is the true statement. Cadaveric spasm. Cadaveric spasm is one of the very important finding in case of drowning. In fact, it is one of the sure sign of drowning. Pult of hemorrhages, they are also seen in case of drowning. There are hemorrhages seen over the lungs. Arsenic in hair root, that is a false statement. So answer for this question is D is the correct answer. So let's discuss briefly about what are the important findings in case of drowning. Okay. The first finding, so that is the froth. Froth. Fine leathery froth. The froth contains surfactant, mucus and water. Why is it occurs? It is because of churning in water along with the surfactant. So what is the composition of surfactant? And what is the surfactant levels in freshwater and saltwater drowning? That's very commonly asked, and it is a non-specific finding. Second, so this is known as washerwoman hand. So washerwoman hand. So what is washerwoman hand? Washerwoman hand is sodden, bleached appearance of the hand. If it's seen in entire hand, 24 hours. If there is a peeling of the skin like a glow, 3 to 4 days. If it is seen only on the fingers, 3 to 4 hours. Then cadaveric spasm. So this is what cadaveric spasm. A cadaveric spasm is one of the sure sign of drowning. Then look at this. So this is the emphysema aquosum. Emphysema aquosum. Okay, which is also a finding in conscious drowning. Diatoms, very commonly asked. It can be asked in upcoming exam. Please go through this in detail. So the fifth finding. Then cutis anserina. So this is the sixth one, which is known as cutis anserina. Cutis anserina. And the last one is the pult of hemorrhages. Pult of hemorrhages. So once again I'll repeat. So what are the findings in case of drowning? Froth, washerwoman hand, emphysema aquosum, cadaveric spasm, pult of hemorrhages, diatoms. Very important finding of antepartum drowning is cadaveric spasm with a mud or aquatic matter in the hand. Yes. Tattooing in case of firearm injury is due to. Remember, tattooing, we discussed many times. Tattooing is because of unburnt gunpowder. So answer for this question is unburnt gunpowder. Okay. Soot particle. The soot particle give rise to blackening. Okay, it gives rise to blackening. Muzzle imprint, it is seen in case of contact entry wound. Contact entry wound. Heat, that gives rise to singeing of the hair. So answer for this question is unburnt gunpowder. So tattooing is one of the very important finding in near range shot. Okay, blackening is a very important finding in close range shot. Okay, you can see here, product of firing a gun responsible for detected by. The flame give rise to burning, scorching and singeing. Smoke give rise to blackening. Unburnt gunpowder give rise to tattooing. Okay. So, and difference between, so that is the blackening and this tattooing, that is the wiping the wound with the wet sponge. The blackening vanishes, so the sponge becomes dirty. But in case of tattooing, the wiping of the wound with a wet sponge, tattooing does not vanish. Sponge remains the clear. Next, sixth question. Patient had a history of previous surgery, came with a history of abdominal pain and fever. So patient is suffering from some fever, some inflammation or some septicemia or something. So X-ray of abdomen was taken. X-ray of abdomen was taken. The finding is given below. So finding, you can see here, instrument in the abdomen. There is some instrument in the abdomen. So this instrument corresponds to. It is the fact speaks for res ipsa loquitur. So answer for this question is res ipsa loquitur. So res ipsa loquitur is the correct answer. So it is not vicarious liability. It is not novus actus interveniens. It is not res judicata. It must be res ipsa loquitur, correct answer. Yes. What is res ipsa loquitur? The thing, the fact speaks for itself. It actually a component of criminal negligence as well as the civil negligence. So what are the prerequisites? In the absence of negligence, the injury would not have occurred ordinarily. So this is what the very important component. Would not have occurred ordinarily. Doctor had exclusive control over the injury, producing instrument or treatment. The patient was not guilty of contributory negligence. So res ipsa loquitur is the fact speaks for themselves. In upcoming exam, there can be question about res judicata, res indicata, vicarious liability, last year question. Novus actus interveniens can be asked. Yeah. What is novus actus interveniens? It refers to a situation where doctor has been negligent because of some completely unexpected, unforeseen act of the act that happened which worsened the patient condition. That is novus actus interveniens. It is also known as act of God. So what are doctrines you must know? First one is res ipsa loquitur, that's very commonly asked. Novus actus interveniens, act of God, vicarious liability. Let the master answer. Okay. Doctrine of deep pockets, doctrine of common knowledge, calculated risk doctrine, therapeutic misadventure, res judicata. Judicata means already decided, judgment was given. Res indicata also you must know, products liability, and test for medical negligence. All this actually very commonly asked question, and go through the standard textbook for the answers. Okay. Next, look at this. Doctors accidentally amputate wrong limb on elderly patient in a tragic mistake. So it is actually res ipsa loquitur. The facts speaks for themselves. It contributes to criminal negligence. Yes, wrong patient. Example for criminal negligence. So question number 7. Finding in the image given below. So the image is given. So whenever there is a collection of blood in the subcutaneous tissue, it must be a contusion. Okay, the same image given, answer should be contusion. It is not laceration, it is not stab wound, it is not abrasion. But some student, they think that, so this is the image given in the exam. Finding in the image given below. So whenever you see this image, whenever you see parallel lines like this, so whenever you see parallel lines, it must be Gray's abrasion. Gray's abrasion is a type of abrasion. It is also known as brush burn, one of the commonest abrasion in road traffic accident. You will see the parallel lines. Okay, yes. Next, 6 types of contusion, very commonly asked. The first one is the subcutaneous bruise. So this is the subcutaneous bruise, one of the most common bruise. So this is raccoon eye or migratory bruise, very commonly asked because of fracture of intracranial fossa. So this is battle sign, very commonly asked because of fracture of middle cranial fossa. Sixpenny bruise, so this is sixpenny bruise. Sixpenny bruise. Then this is known as tram track bruise. Tram track bruise. This is known as deep bruise. All this you must know. Go through each topic and memorize it. There are 6 to 7 types of contusions. Next, there are 4 types of abrasion. One is the Gray's abrasion. So this is the Gray's abrasion we discussed in our classes. Gray's abrasion. Second one is the scratch abrasion. Scratch abrasion. Third one is the pressure abrasion. Example, ligature mark. And last one is the imprint abrasion. Imprint abrasion. Example, tire mark is example. Identify the type of asphyxial death. So this is very simple question. The answer for this question, so you can see here. So a metal wire is placed which is tightened from the behind. There is no suspension of the body. It must be garroting or Spanish windlass. That is the correct answer. Lynching. What is lynching? The lynching is homicidal hanging. That is not the answer. Bansdola. That is bamboo stick. One is placed one front and back, and twisting of the neck leading to asphyxia. So mugging, that is constriction of neck in the elbow bend and knee bend, leading to asphyxia and death. Answer is garroting is the correct answer. So look at this. So this is garroting. A victim is attacked from behind without warning, and his throat is constricted, leading to sudden loss of consciousness and collapse. So this is known as garroting. The subtype of garroting or special type of garroting, which is known as Spanish windlass. What is the cause of that? Asphyxia. So this is mugging. So this is mugging. This is Bansdola. And question number 9. A 76-year-old lady presents to emergency department with an increasing somnolence and lethargy. Her symptoms developed on the day of admission. Her symptoms are associated with headache, mild nausea but no vomiting. There was a history of fall or blunt trauma. A head CT without contrast demonstrates crescent-shaped hyperdensity that crosses the suture line. So, and died after 4 days. Autopsy finding is given below. What is the best diagnosis? Remember, whenever hemorrhage, hematoma, that is below the dura mater, it must be subdural hemorrhage. Here the key points are crossing suture line, 76-year-old. Okay, so and the image that shows that SDH is the correct answer. So answer for this question is subdural hematoma. Subdural hematoma because of bleeding from the bridging veins. Okay. Yes, EDH. What is EDH? So EDH, it is because of bleeding from the middle meningeal artery, usually arterial origin. SAH is because of rupture of the berry aneurysm. ICH, it's very commonly seen in hypertension. So it is the intracerebral hemorrhage. Okay. Yes. So the question number 9 answer is SDH is the correct answer. Last question. Source of SDH bleed is the very simple question. The source is bridging veins. It is not middle meningeal artery. It is not berry aneurysm. It is not middle cerebral artery. Your answer should be bridging veins. So there are 10 questions asked. So thank you. Happy reading.